Good afternoon. Thank you for sharing your super valuable time with me for a little while to talk about health equity and healthcare change. Today, I want to talk about a question I've had to answer for myself as the CEO of a company, and that I think you might be asking as you learn about us and contemplate taking the journey to address global equity with us. And that question is, why me? Why you? Why us? The brief answer is why not? But I'm going to start with a little story. I have a little doggie and I love walking her every day. She loves it. She gets exercise. She gets to smell all the smells. And I get something out of it as well. I get to do something good for her. She does not ever thank me personally. She's actually quite independent and enjoying the time outside by herself. But I get something in return because I get quiet time, time where I spend with her. And I just enjoy nature. I enjoy the neighborhood. And sometimes I talk to people. But on that walk, I carry a bag. I'm very diligent. I have water for her. We're always prepared. And of course, as a good citizen, I have to clean up after she goes potty and makes a bowel movement. And I find myself getting frustrated as I walk by unpicked up dog waste along my route. And for a while, I kept doing this, and I would find myself frustrated and thinking, what can we do to get people to do this? Why don't they understand how important it is to pick this up? The impact it has on how we feel about our neighborhood, the impact it has on spreading disease and germs. What if some child walks into it? A whole flurry of thoughts. Of course, that doesn't make my walk very good. And then I said to myself, as a person contemplating making global change, the answer here is, what can I do about it? So now I take my walks and I carry lots of extra bags and I pick up any undiscarded waste along the way. Sometimes I even pick up garbage I see along the way. And after doing that for a series of days and a series of weeks, guess what? It is so much cleaner along my walks. I take different routes to make sure I can clean up different routes. And by making one small, selfless, messy, smelly, dirty act each day when I'm taking that walk, I'm making a difference that's making me happier when I take those walks. And so with that, I'm going to talk about why us. Why do we need to make the difference for global equity? 2020 to 2023 were a dark and revealing time for healthcare across the globe. These were the dark years of the COVID-19 pandemic. During this time, we witnessed multiple brave, selfless acts from our healthcare workers and other frontline workers across the globe. What we learned in healthcare was our best defense against the virus and for taking care of ourselves and our patients were the tips, lessons, and connections with our colleagues from across the globe. The global community taught us the most about the characteristics of the virus, about what treatments we might use to take care of our patients and save more lives, about how to find PPE that was not given to us by the healthcare institutions we work with, how to sanitize our PPE when we were asked to reuse the same PPE for days and weeks at a time. And we found that our leaders, the people we usually defer to and look to in times that are not as unstable, our government, our political leaders, our healthcare institutional leaders, were focused on certainty, the economy, and their own political or job survival. Some people left healthcare during this time. They lost hope, they lost trust. They didn't feel that the personal risks to themselves, to their families, were worth the risk because they did not have hope that it would lead to an improvement for either themselves or the patient. They felt betrayed by the system they had worked in their whole lives. They were asking themselves, how will my sacrifice lead to an improvement and a better future for myself or my patients? A 2021 to 2022 AMA survey, this is 2 years after the start of the COVID-19 pandemic, found that 40% of physicians were considering leaving their jobs within 2 years. 40% of current physicians were going to reach the retirement age of 65 within 10 years. And 12% of physicians between the ages of 51 to 60, so those in the 15 years leading up to retirement, wanted to work part-time. There is already a global healthcare workforce shortage of 15 million healthcare workers. How will we be able to bridge that global healthcare workforce gap to provide healthcare to the 78% of people across the globe who live in low and low middle income countries with the very lowest healthcare infrastructure and highest healthcare needs? How and who will return the hope, trust, connection, and selfless service back to medicine? Will it be our insurance CEOs? Will it be our hospital CEOs and C-suite? Will it be our politicians and lawmakers? Maybe it's some unknown stranger who somehow knows exactly the right thing that's needed and to do. I'm here to say to you that those are not the right answer. The answer is, it's us. It's me, and it's you. And that's why I'm talking to you today. Imagine a global healthcare community sharing their challenges, their solutions, their lessons, just like we did during COVID, but with the challenges of today, with equity, with healthcare access, with how to deal with the next pandemic of the future. This community advocating for themselves and for patients across the globe. Imagine leaning on a global community outside of your local community when you need help. Perhaps your community has had a natural disaster, has had a climate catastrophe, has had an outbreak of some kind. Well, there's others that aren't local that may have more resources and may know some things to help you. Imagine leaning on them like we did during the biggest pandemic of our time, and then giving to that community when they need help. What if we could do culturally competent care while still growing professionally and expanding our medical and personal perspective? This is the wonderful future that we need to create. Why? To honor and respect the dignity and the vast human potential of all life that currently exists. People cannot wait for future generations to feel seen, heard, cared for, and to experience real healthcare equity, to decrease human suffering through healthcare available to all people across the globe, and to uplift and empower ourselves and the healthcare community in the process. If this sounds like something you would like to see and be a part of, please contact us at HAEW.org. Join us in creating a healthier and more equitable world. We look forward to seeing you. Bye.